Hi, welcome to Medical Monks, where your care is our highest calling. I'm Nikki, and today we want to take a look at a family of products, actually a reworking of original products of some old favorites from a company called HartmannUSA. This is the Zetuvit family we're talking about, so you could say we are doing a Zetuvit on this family of products. It's a really standard kind of wound dressing that is maybe familiar to you if you've been in a care setting before, if you are a clinician, but with a few twists, some really good upgrades, some things that are going to make this a better product for you, and we're going to talk about what those differences are and how it can benefit you. So let's talk about some of the reasons behind the updates and the improved design. It really is with you, the patient, in mind that they have made these improvements and improving quality of life, ease of use, and really trying to help find balance between taking care of and managing your wound and your life. So a couple of things that were in mind were your comfort, protecting your skin always, the ease of use, storage, things like trapping odor, just all kinds of things that actually interfere or are concerns in living our actual lives, right? We are more than just our wounds. So some of those improvements that were made are that they are now actually stored in individual see-through pouches as opposed to being in a tray, so it takes up less room if you're a clinician in your office. If you are at home, it takes up less room in your medicine cabinet or your loved one's bedside. They also now have their name printed on it, which is kind of cool because I don't know if you've ever left a hospital or a doctor's and you come home with something that worked really well and wondered, what was that? So now on the back of it, it actually does say the name of the product and you can go find it. A couple of other things to keep in mind are the absorbency has been increased by 50%, so that is great, while the pad has actually been slimmed down some for a nicer profile. We have perforations on the front, on the underside, what comes in contact with your skin, as well as on top, and we're going to talk about in a little while why that is important for you and your wound. And maybe more interestingly or importantly are an increase of 7 new sizes and shapes. So a couple of the more unique wounds that we will see in mostly home care and clinical settings, long care facilities, are things like the sacral wounds, bed sores. Things on your heel if you are suffering with or know someone who is suffering with diabetic ulcers. We have now products that are going to fit those particular hard to fit areas. So here's the new and improved Zetuvit. You can see it has new rounded corners, which is great for just a softer application and you're not sticking anything, the corners aren't getting jabbed anywhere. You can see that it's a cushy little pad here, very easy to peel off the back. I hope you can see from here that it is fenestrated. That means it has perforations, it has holes, and of course if I was a clinician I would have gloves on. The purpose of the perforations is a couple of reasons. So for one, you'll notice that the pad itself is not actually sticking to the wound. It's not going on top of the skin. The actual silicone is. So we don't have any of that that gauze or that sponge or the foam. Nothing is actually coming in contact with any of the healing skin. The perforations allow the exudate to be drawn up and out of that wound into that pad. And that pad serves a really specific purpose. It's not just pulling out drainage or that exudate. It's actually trapping a couple of things. For instance, something called MMP, which is matrix metalloproteinases. Big word. What does that mean? It's something that actually helps new skin grow, but too much of it, as everything in life, is a bad thing. And so it controls that, locks it in, and secondly, it allows that exudate to evaporate and come out. But then on the surface, this actually prevents contact with viruses and all kinds of other microbes, things that are going to go ahead and perhaps infect your wound. So we've got protection going this way and protection going that way. So how long can you use this particular product? How long should you use this? Well, that's the really neat thing about this particular product. You do have some that are designed for everyday use, and you have other products on the market that are designed to be in place for up to 7 days. This one, it'll do anything you need it to, anything your clinician directs you to. So if it needs to be checked, if you have a wound that has some kind of a concern of complication, you actually can pull that layer off very easily without disturbing that outside layer of skin. And if you have to do that on a daily basis to check a wound, it won't take you too long to really appreciate that you are not over and over again ripping up that skin. Which actually leads me to the reason to have the border around the outside of that dressing. It's not just to adhere that pad in place, it's also to protect the clean skin, the healthy skin that already exists around the wound from something called maceration, which is just a icky kind of word for too wet to actually survive. It'll tear up that skin if it gets too wet. So it's protecting from leakage from inside that wound onto the clean and healthy skin. If you need to actually have that in place though, and your doctor gives you the okay, and you need to leave it in place for 7 days, this will stick. It'll stick through showers, it'll last for the entire week, and it'll save you a little money if you don't actually have to change that more than once in that time frame. Thanks for hanging in there with me. That was a lot of information, but if it's you, it's your loved one, if it's your wound, it's going to be helpful to you, I hope. If it was, please be sure to like and subscribe and follow us for more content just like this. Thanks so much for joining us.